Hi everyone, and today I thought I'd do a quick video discussing whether the onset of Tourette syndrome is gradual or abrupt. It's actually very different for everyone because Tourette's affects every single person very differently, and when you've met one person with Tourette's, you've met one person with Tourette's. And I honestly don't think anyone could fully understand it unless they've either experienced it themselves or they are a parent positively advocating for their child. So some people have a gradual onset, which is where they may start with mild tics, maybe in the face and head, and then it might develop into the rest of the body. But then other people like myself have quite an abrupt onset. For me personally, my abrupt onset was overnight, and although I did show some signs as a toddler, such as spitting tics, tensing muscles, dribbling, and a few OCD tendencies such as hand washing and high anxiety levels, when I was 8 years old, I went to bed as a typical child with not really any difficulties, and I woke up the next day severely disabled and very, very different. I was being engulfed by this collection of complex symptoms: tics, OCD, anxiety, rage attacks, sensory issues, you name it. I'd completely changed and I'd become severely disabled because I could no longer dress myself, sleep in a room my own, walk upstairs in my own home, or use a toilet in my home, and I found it difficult to use a laptop, and I found it difficult to write, and my childhood had been stolen away from me like a thief. And I remember this was very scary for my parents because my parents were scared they'd have to look after me for the rest of their lives. And my mum was doing some research in the first few weeks of onset. She phoned my dad, told him that she thinks I have Tourette's, and my dad started crying simply because it was so scary for them that I had a lifelong condition. They were worried that it wouldn't get better. And they were also scared when they were looking at the treatments and found DBS, which is a brain surgery for severe Tourette's, as they thought I might need to have that. Luckily, I don't need to have that anymore because I manage my Tourette's through diet, as my Tourette's is related to the immune system. It's where, for me, allergens in the diet trigger inflammation in the brain, and that high level of inflammation was triggering all the complex symptoms. Now, if you have an overnight onset, then I would highly recommend ruling out PANDAS syndrome and PANS. PANDAS syndrome is a autoimmune disorder triggered by strep that can cause Tourette and OCD-like symptoms. And to check for strep, you can get a blood test by molecular labs. It's called the Cunningham panel, but I think you can only really get that in the USA. And in the UK, what I did to rule out PANDAS was I had a blood test to check for underlying strep. And even though I know that isn't always accurate, luckily for me it was accurate and showed that I did not have any underlying strep. And although PANS is a clinical diagnosis, and I did have most of the symptoms of PANS, for me it's Tourette's, as it wasn't triggered by an infection, and although it is related to the immune system, it's related to allergies, which is quite common in some people with Tourette's, as Tourette's is associated with histamine. Another early symptoms I may have shown of Tourette's is my severe food dye sensitivity, as I had a food dye sensitivity that was detected at age 3, so that could have probably been an early sign as well. But for some people, signs of the co-occurring conditions can actually occur before the tics begin. So some people may have signs or a diagnosis of ADHD, OCD, or sensory processing disorder before the tics even begin. And also, as I was saying, it's important to rule out PANDAS and PANS. The reason for that is, if PANDAS and PANS isn't treated, then it can lead to long-term cognitive damage from the antibodies attacking the brain, and that can lead you with a lifelong struggle with neurological and psychiatric difficulties, which nobody deserves. And the treatment options for PANDAS and PANS are slightly different than those for Tourette's. So it's important to find out what's triggering the condition so that you can treat it effectively. But yeah, for me it is Tourette's, even though it was overnight and I had all the symptoms of PANS, because it's mainly related to allergy for me, and by eliminating the allergens, the inflammation in my brain has gone down. And I also do have a family history of tic disorders on both sides of the family, which shows me that I have Tourette syndrome. But the overnight onset is very scary, because I remember my mum would sit on my bed every day once I'd eventually got to school, because it took me ages to get to school, but she'd sit on my bed, look at the toys that I could no longer play with, and cry, because she was mourning for the child she'd pretty much lost for 4 years, because I completely changed. It was almost like my personality changed as well, as I became a completely different person, but that was due to the inflammation in my brain, and the fact that I was being engulfed by all this anxiety and obsessive compulsive behaviours. So my life completely changed at that moment of the overnight onset. And I'm not too sure what triggered it. I know the night before my severe onset I was very anxious, so maybe that would have triggered it, I'm not too sure. But it's very different for everyone, and some people may show signs of co-occurring conditions before, some people may have mild tics that turn to more severe tics, and other people have an overnight and acute onset. So yes, it's very different for everyone, and what I want to say is if you do have an overnight onset, or sometimes even if you don't, then you probably should rule out PANDAS and PANS, because I personally believe that everyone with Tourette's and OCD should rule it out, just so you know what treatment options might be more effective. I hope this video has helped, and I hope you liked it. Bye!